Hey guys, welcome to Medical Mondays. In this chapter we're going to be covering anatomy and physiology. This is the foundation of a lot of the conditions that we're going to focus on in later modules as well. We're also going to review quickly some basic terminology you should be very familiar with, especially when we're starting to do our reports to EMS. So the first thing we're going to look at is the anatomical position and the terms that we refer to a person when they're in the anatomical position. So as you can see here on the right, we have basically the anatomical terms. The terms medial and lateral, medial meaning towards the middle, lateral meaning towards the side. Obviously the midline being the middle point of the actual body. The other two terms that you see in this diagram are proximal and distal. Proximal means towards the trunk, distal means away from the trunk of the body. Major body cavities. So we divide the body into 5 major cavities. The cranial cavity. The cranial cavity is the head, and it's protected by the skull. The spinal cavity, which is actually the spine from the cranial cavity all the way down, sends all the nerves through the spinal cavity to each part of our body. The thoracic cavity, also known as the chest cavity, which consists from the neck to the diaphragm itself. The abdominal cavity, which is from the diaphragm to the pelvis, and then the pelvis cavity, which is the pelvis itself. The abdominal cavity, being such a big area that consists of lots of organs and tissues, we generally divide into 4 quadrants. We'll come back to that point when we discuss our secondary surveys, why it's important to assess each quadrant properly and understanding what organs and tissues make up the 4 quadrants. The respiratory system. This is the main highway for oxygen to get into our bodies. It's also important to note all the anatomical terms in the upper and the lower respiratory system. Once the air full of oxygen gets all the way down into the alveoli sacs, the heart sends the blood by to pick up that fresh oxygen and gets rid of any waste gases. So that the next time we exhale, the alveoli sacs will push up the airway any gases that we need to exhale out. This whole process is done by the inhalation and exhalation phase. The inhalation and exhalation phase. It's important to understand how people breathe. Inhalation is actually triggered by low levels of oxygen in our bloodstream. Having said that, a little later in our respiratory chapter, we'll talk about certain conditions where the part of our brain that it's always scanning for low levels of oxygen can't do that properly. In individuals that don't have any respiratory conditions, the brain is constantly scanning for low levels of oxygen, which will cause the diaphragm to contract, and that is how the air actually enters our body all the way down into our alveoli sacs. Once the diaphragm is finished contracting and it relaxes, as you can see by the far diagram, we exhale any gases that have come out of the blood back into the alveoli sacs. The circulatory system is a closed system. We're going to focus in on this system throughout a couple of different modules coming up. The blood comes back to the heart through the venous system. The venous brings the blood back through the right side. The right side of the heart, as you can see here by the diagram to my right, brings the blood to the right side, and that right side of the heart's responsible for getting fresh oxygen inside that blood. It will send it by the lungs, get fresh oxygen inside, get rid of any bad gases, and then it sends the blood to the left side of the heart. The left side of the heart will then pump that new, freshly rejuvenated, full of oxygen blood to the rest of the body. The arteries will go to the farthest points of the body, they will get small, turn into vessels, and then they will also turn into veins. Veins will then start that process again. Veins will bring blood back to the heart. And again, we'll get rid of any bad gases, put fresh oxygen, and then the blood will go to the left side of the heart. The left side of the heart will again pump blood now full of fresh oxygen to every part of our body. Those arteries will become smaller, they'll become vessels, and then they'll become veins. And veins, of course, carry blood back to the right side of the heart. This is a closed system. There should always be a constant pressure. In a later module, we'll focus in on why there's always this constant pressure when we talk about blood pressures. What makes the heart do that mechanical ability of getting that blood to come back to the right side, sending the blood to the lungs, sending it to the left side of the heart, pushing it out to the rest of the body, is this system right here. This system is called the conduction system. The heart has its own mind, this conduction system. As you notice, there's specific spots where electrical impulses will go off. They'll generally start in the top right corner, the caonatural node, down to the AV ventricle node, down to the Purkinje fibers. If you notice, in the top right corner, there's an electrical current. And then you'll notice as well in the lower left quadrants. Pay attention to that and think about where we put our defib pads. Our pads specifically go in very similar areas where the electricity would travel if the conduction system was working properly. The job of most defibrillators is not to focus on the mechanical ability of the blood flow of the heart. That's what we do with CPR. It's to restart this conduction system to a rhythm where it allows the heart to circulate blood properly to its natural mechanical ability. The nervous system. In a previous slide, I showed you the spinal cavity. The spinal cavity sends these nerve ends to all various parts of our body. It's important to understand that nerves go everywhere around our body, to each extremity, to the diaphragm, to help with our breathing, to our heart, to control the speed of our hearts. All areas of our body have nerve endings that are transmitting messages back and to from the actual heart itself. It's important to understand that most body parts have nerve endings that are sending messages or receiving messages from the actual brain itself. I want you to pay attention to each extremity, the arms and the legs. You'll notice that there's 3 specific nerves going to each arm and leg. This is important when we're assessing extremities, mobility, sensation, and circulation, that we assess all 3 things properly. As you can see, each nerve end does something specifically. You can ask an individual to wiggle their toes, and they might be able to wiggle their toes following a head injury, but you can ask the individual if they can feel you touching their toes, and they can't. So it's very important to remember that when we're assessing extremities, that there's specific nerves for different functions. The musculoskeletal system. There's 206 bones in your body. You're not expected to remember all of them. Here's the more common ones. In a later chapter, we'll focus in on injuries to these specific areas. You'll notice the bigger bones in the body, the femur, the humerus. We'll talk about care when they break. We'll also focus in on the smaller bones, around the wrists, the ankles, that have tons of ligament tissue that support them. These areas are also prone to things such as sprains. We'll also focus on the fibula and the tibia. Those are thinner bones that are almost like toothpicks. Generally, those 2 areas, the lower arm and the lower leg, because they're made of thinner bones, are also prone to deformity. We'll definitely cover that in a later chapter. Another important system is the skin. The body relies heavily on the skin for 2 big functions: prevent against infection and regulate body temperature. In a later module, we'll talk about burns and the complications of burns. Most people succumb to their injuries because of the inability to regulate a body temperature properly or infections. The digestive system. When we respond to these types of emergencies where people are having abdominal pain, as we spoke about in a previous slide, it's important to understand what organ in each quadrant of the abdominal cavity. This diagram does a great job of explaining where the liver sits, where the spleen sits, another significant area that is prone to trauma injuries, where the intestines sit, the large and the small intestines, where the appendicitis sits in the lower right quadrant. Take a couple seconds to familiarize yourself with the more common organs, which will help us as we get into a secondary survey assessment, understanding where these organs are in each cavity. So there you go. We just spent some time looking at the different anatomical terms. We spent some time looking at some different body systems. As we start moving through the chapters, I'm going to reference these anatomical terms. I'm going to reference these specific body parts, organs, and tissues. Take some time to review this module, and it'll make a lot more sense as we get into the physiological aspect of why people have certain conditions. Remember, our job's not to diagnose these individuals, but it makes us understand and appreciate a lot more of the signs and symptoms, and it makes us understand these vitals a lot better when we understand what's happening inside the body, and of course where things are inside the body. We'll see you in the next module.